Yeah, so this is really applicable to any sort of clinical setting. The use of translators is really an interesting process, and I find it particularly interesting because I've had the function of both like providing services in another language as well as having to watch somebody provide really bad interpretation for services while I'm doing them, which is a little bit frustrating. But there are some basic sort of general guidelines that have to do with like the functionality and the logistics of how you use a translator, as well as some of the thoughts in terms of clinical practices and how it might impact intervention, interpretation, things like ethics, like duty to warn, and things like that. And so feel free to ask any questions as we go through this process. I want to make sure that you guys have enough information to utilize an interpreter and understand how the process should work and what to do, like when it's not working exactly the way it should be working, how to recognize that process. For anybody that's providing interpretation, I want you to like get an understanding of what your role is and what you can do, because the interpreters really play a big role in the clinical process, and so they have a lot of feedback to offer and give as well. You don't have to just be like an interpretation robot through this. You're not like a human babblefish sitting there just like providing information back and forth. We want you to have input in this process. The first thing to know is that using an interpreter in clinical practice is a lot of work. It takes a lot of extra effort that you wouldn't normally have to do in clinical practice. So it takes a lot of pre-preparation. So you have to have a discussion about what it is that you're going to do, what your expectations are, especially if you've never worked with the interpreter before. So I've been fortunate enough to have people that just like show up on the spot, but also people that I have long-term relationships with. I've worked with on several occasions to provide interpretation. And so they already have an understanding of what my expectations are. And I also know what to expect from them. There's a lot of variability as interpreters in what you do and how you want to do that. And so as a clinician, there are certain things that you can identify that you like, and you can request interpreters to do those things as part of this process. So for example, one of the things I really like about a good interpreter is they tell me what's happening all the time. So they're not just providing interpretation, they're telling me, there's something happening, there's something going on. I think a lot of times it's a speech impediment, or they've said something and the interpreter themselves is not clear. Just like with any other sort of language, we have sayings and idioms that we use. The same thing happens in other languages, and sometimes an interpreter may not be aware of the idiom or the cultural sort of use of the language at that point, and they want to clarify. I always appreciate when the interpreter tells me, hey, I'm going to stop right now, they said something and I want to clarify what that is. And so that's an example of like getting to know your interpreters and a beneficial skill that you can have. But it's also something that you might want to do before you go through this process. So in terms of the workload, that preparation, that initial like setting expectations for your interpreter is really important. So telling them, hey, it's okay to stop the process. So if they're running behind, which often happens, is like that person's talking, they're having a normal conversation. As the interpreter, it's okay, as long as your clinician's like okay with it, to stop the process. And as a clinician, if you're hearing a lot of information going forward and you're worried that, hey, this is a lot, I feel like I'm not getting any feedback, you want to stop the process. But it's always odd if it happens in the moment. Like, so all of a sudden you guys haven't discussed this, the process is happening, and all of a sudden you're like, wow, it's been like 15 minutes and I don't know what's going on. So stop the process. Feel free to like interrupt, but that should be a conversation that you should prepare for ahead of time. So as the clinician, you should talk with your interpreter and say, hey, if things run long, don't feel, if you feel like you're running behind on the interpretation, like feel free to stop the process, that kind of thing. Sometimes you might want to prepare the interpreter for what the clinical process is or what's going to happen that day, so they know what sort of information to expect.
Yeah, and so this is brand new for you, just so both of you know that there's a huge gap in between services that are available for Spanish speakers and providers who speak Spanish to provide those. So we're trying to figure out how we can kind of help to close that gap. So any of those of you who are interested in get a Spanish speaking client assigned to you, you will need to meet with Monica or Rosie, whoever you're working with beforehand, to go over what you're going to do that day. And it could be right before the session or the day before, whatever kind of works out for you. It could even be over the phone. but most of the treatments that we utilize are manualized, and so ideally you would send them, like, this is what we're gonna cover tomorrow, in session, so that they have a chance to review it, and probably not the night before, several days in advance, and then carve out time before to have a conversation about what you're gonna accomplish in the session with the client, because I think what we learned through troubleshooting with Caroline, who was our guinea pig last semester, is just that preparation is really, really key and important in the process. So I think that's probably the first thing that I would recommend. And then if you're doing assessment, you will probably want to do the same thing, is meet with your interpreter beforehand and talk about how you do an intake. So all of you vary in terms of how you do an intake.
Yeah, so it's really important to say, for example, for the prolonged exposure, you might want to clue your interpreter in that, hey, we're going to be talking about, like, this is a victim of sexual assault. We're going to be talking about sexual trauma today. So they know what sort of things to expect in that process. Assessment is another really key thing, because you have these administration processes, and in order for them to remain as valid and reliable as possible, we need to ensure that we adhere to the protocol. And so part of that is preparing the interpreter for what to expect in terms of test administration, how to provide responses in terms of whether they should be verbatim or a looser interpretation, or those kinds of things.
And if you're doing assessments, if you, we can try this to do, is where I have you do a whole battery with a Spanish-speaking client, you're non-Spanish speaking, you do the intake, the MMPI, RF, which you would, that's just, they fill out like a questionnaire, so you would give the interpreter the instructions, which they would relay to the client. And then the TONI, you would meet with the interpreter beforehand and go through, but that's a non-verbal test that's essentially administered with no verbalization.
You can do it either way.
Okay.
Yeah.
So you would.
But that would be something to discuss
Yeah,
beforehand.
you would discuss that with the interpreter, but I think the assessments we're using on this team would be actually pretty easy to administer.
Especially the ones that are in Spanish already.
Right.
You hand them over, but they do require some clarification sometimes, and so you might want to discuss how much clarification to provide. The other really critical issue that's important in interpretation is that oftentimes our clients want to talk to the interpreter. They want to have a conversation. The conversation might derail in terms of, where are you from and how's it going? Because there is a relationship. This is the person that's hearing the information. They're talking through you. And so it's really important that the clinician is making eye contact and conversing with the patient while they're talking, and vice versa. The interpreter is not, and I don't know, you guys can discuss this.
Yeah, let's talk about that a little bit. So Brian and I went to training on using interpreters, and they did just like a fabulous job of kind of showing like all kinds of mistakes that can happen. But I'm picking on Jenna. So Jenna kind of being the client here, if I'm the interpreter, my job is kind of to go between Jenna and Brian as a clinician, like this. It should not become a conversation just between myself and Jenna, right? Or vice versa, myself and Brian. It's kind of, I'm acting just as kind of the person going in between the two. So my eye contact is with Jenna when she's talking to me, and then I'll shift my contact to Brian when I'm doing interpretation. Yes?
Yes.
And then for those of you who are not Spanish speaking, your job is to focus completely on Jenna. So not so much on the interpreter. So she's the client and whatnot. So it's awkward, right? So we're used to, like, if I'm talking to Monica and to Jenna, I'm going to be going back and forth, right? So, but as a clinician, really who I'm talking to is Jenna, right?
Right. And there are some times that you'll need to communicate with the interpreter or whoever's providing translation, and you should still talk to the client and tell them that that's going to happen. Say, I'm going to take just a second and talk with the interpreter. I didn't catch something, or I want to clarify something with the interpreter, and then you can talk with whoever's providing the translation. But make sure that when you're doing a clinical interview, when you're engaging in clinical services, that you're engaging with the client and not with the interpreter, unless you've told the client that that's what you're doing.
Because this would be like if I'm the clinician here and I say to Monica, can you ask her what she said happened to her when she was 5, right? That's terrible, right? Clinical skills, right? I'm ignoring Jenna. I'm talking about her like kind of in like this sort of secondary sort of way, versus if I say, hey, could you tell me, you said something had happened to you when you were 5, could you tell me what that is? And then Monica very skillfully says what I just said to her. So now it's like Jenna and I are having a conversation, which is kind of what you really want to strive for as a therapist or as a clinician, psychologist.
And the same thing goes if you're providing the interpretation and you need to clarify something with the clinician. Tell the client, I need to clarify something with whoever you're working with. I'm going to ask them something, and then ask the question and then return back to the client. So just inform them first of what's going to happen so that they know and they're not like excluded from the process. Like Lorraine was saying, it's kind of a common factors thing, but it's a little bit odd when we've got this third person in the room that's helping us in this process that's not normally there. We're not used to engaging in that sort of process.
So when you're listening, if you're the clinician and you're listening to the interpreter, you're looking at the client.
Exactly.
Okay.
Yeah, so your focus is always on the client. Anybody in here, so Jenna I know is bilingual, Francis. And so one of the other things that comes up, and this I don't know will necessarily be the case with you, but sometimes you'll have to work with an interpreter where you have some understanding or a partial understanding of the language or even fully understand the language. And you've got to decide ahead of time how you're going to work in that process. That was occasionally the case for me because we would do group evaluations. And so I would decide ahead of time, I'm going to do, if we're going to use an interpreter as a group, I'm going to do everything through the interpreter, right, as part of that evaluation process, just so that it's like a balanced sort of thing. And if I record things from the interpreter, I actually record both things, what the interpretation was or my interpretation, and annotate what they are, especially if there's a discrepancy in sort of that process. But that's,
in general, that won't be the case.
That won't be
here.
the case. It might be the case for Jenna, but in the future, if you
It'll be
encounter
the case for you when you're training,
Yeah.
but that'll just be more like a training process.
That's good,
Well, because you're
for
training.
somebody that doesn't
Yeah.
speak Spanish.
Yeah.
it's
Yeah.
like,
Well, and
That's
some
true.
settings have
Absolutely.
requirements, so they require like
Yeah.
certifications and things like that. So you have some guys that are, but in this role, you'll be like part of the training process. So yes, engage and do whatever you want. The other workload sort of portion of this, so you've got the preparation and the advanced prep that needs to happen before the sessions, providing them with an indication of what's going to happen in the next session, but there should also be a debriefing after the session, discussing, like, because it's impossible that it's going to go perfectly. I mean, even when it's a one-on-one session, there's always things that you're like, oh, well, like, that could have been better. But oftentimes you'll want to talk about, hey, that was like a good session, the interpretation went really well, these are the things that you did that were really helpful, that I really liked, these are the things, next time if that comes up again, let's do this, or let's try this as a strategy. And some of them are going to be client specific, so maybe you have a client that's not very talkative, or maybe you have a client that's overly talkative, which is probably going to be a little bit more of a challenge with using interpretation. And so you'll want to come up with a strategy when those things happen, and debriefing is really the important part of that process. And so again, it's a lot more work. You're not usually doing like preparation and debriefing as a collaborative process. You're doing it independently.
And so for you ladies, when you have a session scheduled with one of the therapists to see a client, and this I guess applies to everyone in the room, you'll want to meet probably 15 minutes beforehand to kind of, I think that would be the most efficient way to do things, meet about 15 minutes beforehand, probably communicate via email before, and then plan on staying together 15 minutes after the session has ended to do this process. And then I think the other thing, which Brian kind of alluded to at the beginning, is given the nature of the work that we do in the clinic, a lot of it is related to people having experienced violence, in their life, whether it's interpersonal violence or sexual violence. And so the other thing I want to just make sure is that you two have an opportunity to kind of process that. Like, that was really hard to listen to. And for those of you who are the therapists, that you kind of give them that space to kind of talk about that. If you think back to when you're a first beginning therapist and you're hearing kind of these challenging stories.
Yeah, and I don't know, I mean, traditionally when I've used an interpreter, it's been in a forensic setting, and so they're kind of compelled to participate in the process. But in this process where we're providing clinical services and they're voluntary, you may want to add a little bit more in terms of the informed consent and let them know that the interpreters still have the same obligations with regards to confidentiality and those sorts of issues. So they're not going to go out and discuss the case. It'll be discussed within the team, but they're still bound by the same rules of confidentiality because there is a third party there.
And I think we had Rosie complete the HIPAA training. Yeah, and so we'll have you complete HIPAA training. You do it online, but essentially it outlines that everything that you hear in the clinic in your role as an interpreter is completely confidential. So the only people you can discuss that with are the people who are in this room right now. I can talk more individualism about that, but that's kind of a really key component. And if you do use an interpreter, you will, as part of the informed consent process, let the client know that we're using an interpreter who's a trainee and what have you.
I have a question. So I don't know. So when I was doing the DBT stuff, the Spanish version and the English version didn't match perfectly. Is that the same for the PE manual?
I don't think so. The reason the DBT manual that's a great question, doesn't map to the Spanish version is because we have a modified DBT for IPV protocol that we're using. So that's where you'll see that mismatch. But I think what we could do is have one of you,
I have the Spanish DBT book,
but not for DB.
No, I have
For
the
PE.
original.
No, because we use a modified DBT protocol that won't map to the, do you know what I'm saying, to the Spanish one? But we can figure out what skill's supposed to map to it.
Yeah, because I went through both actual mixes, because in the Law Clinical they have the full workbooks, but even then the worksheets, there were certain parts that I put into Google Translate, and sometimes it just didn't match.
We'll have to
And it was kind of strange, and I had to do a bunch of work to figure out which worksheets go to which, and then some were longer than others, and some had different examples.
So I'll have you work with Rosie because right now, since we don't have any clients right now that we're going to assign right this second, I'll have you work with her to help resolve that so that we do have things that match up to each other.
Okay.
Because you're right, with the translator it becomes complicated. If you're bilingual, you just read it and you figure out what the mismatch is, but we need things to kind of be in really good alignment for this process to work well.
And then the other thing along those same lines in terms of informed consent and ethical issues is, there may be times where you come up with a mandated reporting issue, and there has been in the literature some indication and discussion about when we use translation, there are instances where there have been really gross violations of confidentiality and ethically questionable sort of reporting issues, where people who didn't have legal immigration status were reported to the authorities for a mandated reporting issue that was misinterpreted and misconstrued, and then it created all kinds of complications. And so if you think that you have a reporting issue, the appropriate thing to do is to clarify what it is that's happening and get sort of collateral information. Remember that most of the reporting is 24 hours to 48 hours. It doesn't have to be immediate unless it's a life or limb sort of process that's going to happen right away. And I'm very upfront. Everybody has their own process in terms of how they engage with the client with informed consent. I tend to be very direct, and this is something that we're going to talk about this. I remind them this is a mandated reporting issue. This is who it has to be reported to.
Are you all going over informed consent aside from having them sign it? There's things I really want to make sure that you understand.
Yeah.
Okay. So if you're using an interpreter, you would do the same thing and highlight on mandated reporting.
Yeah. And if you think it's an imminent life or limb thing, that would be a supervisor call sort of thing, and we'll talk about it so that somebody doesn't get hurt. But the alternative is we don't want to unnecessarily report somebody if it's not necessary. You want to be very certain and clarify. And remember that you do have generally 24 hours to report these things, so you want to clarify exactly what it is that's happening, and as much as possible involve them in the process so that you have a minimal rupture in the therapeutic relationship as possible in that rapport. Because if you engage them in that process, then it's very transparent, and I think that it's less likely to create a permanent sort of rupture in that process. Not something that comes up common, but it's scary enough, or the consequences are serious enough that.
And Rosie and Monica, you two would not have to make that decision. You would
Right.
just relay that information to whoever the therapist is, and then the therapist would know to contact me.
But you could work with the clinician to try and clarify what they said if you
So if
understand
anyone says
something.
anything about child abuse, that they're going to harm themselves or another person, or about elder abuse, am I missing any? Those are the four, right? Then that would be something just right away to keep in your mind. I need to make sure I clearly communicate that to the therapist. I know it's kind of like this vague overview.
So then they're gonna be assigned to me for the first,
Yeah.
just to kind of see
Yeah.
how everything goes.
Yeah.
Okay.
Yeah.
And then in note taking, are you having them indicate that it's being translated and
Yeah,
who the
that should be reflected in your
and
clinical
who's
note that
interpreting?
A translator was utilized, and then you would include their name, their first and last name in the clinical record.
So do you want me to have them translate at all with me, or just have them watch me
No. I want them to go in and act as a translator.
as the translator? Okay.
Yeah. To pride. It's just that then you were there, so if
Yeah,
there's
so I
anything
can
going
kinda-
on, you can
okay.
kind of help remediate it. I think the other thing that we should do, which we started to do last year, but we never finished, we kind of just dropped it off, is we were going through like the PE manual. You guys remember that? Right, we came to one. So I think we should pick up there and then include them as part of that discussion. And then also I think we should do the same thing for the DBT skills. Does that make sense? So I will try and remind myself every week to just send a prompt, like this is what we're gonna go through. And then do we have written materials on the DBT group, or we just
You mean written material?
like that, say like this session, this is what we're gonna cover? Okay. It's in the Dropbox?
Yeah.
Okay.
And I think,
I'll
okay.
send those out each week, because I think what we could do as well is then we could like do a little bit of role playing. Like this is what this session would look like with the translator.
And I think the thing to keep in mind is even with the most experienced interpreters and translators, like this is an imperfect process just by the fact that we're adding another variable to it. And so now we've added this extra level of variability. So it's imperfect just because of that. And then we're trying to create a new process, and we're doing something different that's sort of untested. And so there's bound to be issues. And this is a training process. So expect things to go wrong, and just trying to like work together to fix them.
And then if
improve.
you do have a Spanish speaking client, and you use one of the interpreters, you'll record it, and you'll just like you usually record your sessions. And then Brian will be here every week, every Tuesday at 2 to watch those tapes with anyone who has like a Spanish speaking client.
So then for Friday, I'm meeting with her to teach. What was it?
Interpersonal practice. But it's one with, I didn't get to man, so it's man and give thoughts.
Okay.
So you'll prep Rosie,
Uh huh.
and then we'll do a trial run.
I'm gonna teach you what she's gonna translate. So that way everything else I'm working.
Any questions? How many of you are willing to take a Spanish speaking client? Okay, good. Okay, good. All right. Anything else, Brian, that you can think of?
Probably next week I'll remember.
Okay.